Yeast infection is a fungal infection that causes irritation, discharge, and intense itchiness of the vagina and the vulva. What we mean by the vulva is the tissue at the vaginal opening. So this is the condition that we basically refer to as the vaginal candidiasis, and in most cases, in about 3 to 4 women, most of them have ever suffered this yeast infection in their lifetime. Let me say that yeast infection, it's not classified as a sexually transmitted infection, although in most cases it has an history of getting transmitted via sexual intercourse. That is when maybe you have an unprotected sex with a person who suffers from this yeast infection. I will say that there is more increased chances of contracting this yeast infection, especially if you are sexually active. And let me remind you that yeast infection, this is caused by a fungi and not a bacteria. And so treatment for the yeast infection is basically done by use of the antifungals and not by use of antibiotics. So in its presentation, we have some different we have some of the symptoms that are similar with the symptoms of the urinary tract infection, but it also has some of the symptoms that are slightly different, or that differentiates it from urinary tract infection, or what we refer to as the UTI. So in most of the in classification of the urinary tract infection, we have it when it's mild, when it's moderate, and when it's complicated, or when it's in severe cases. So in mild and in moderate yeast infections, we have some of the symptoms that include the itching and irritation in the vagina, or the vulva, or the opening, or the part that at the opening of the vagina. That's what we refer to as the vulva. We also have burning sensation, especially when you are having intercourse, or when you are urinating. So in this case, it's when during the entire sexual intercourse, you will start experiencing pain, or some burning sensation. We also have issues with redness and swelling of the vaginal openings, or what people refer to as the lips of the vagina. You experience some redness, and you also experience some swelling. We also have vaginal pain and soreness that results maybe from an intense itching, may result to vaginal pain and even having some sores in the vaginal opening. We also have things like vaginal rashes that are mostly seen after prolonged itching. We also have one of the main differentiating thing, whereby people present with a vaginal discharge that is mostly white and it does not smell, or we refer to as an odorless smell that is whitish. In most of the cases, it might look like cheese, and it's a bit thick. So that one is also another differentiating factor of yeast infection from the urinary tract infection. We also have issues with watery vaginal discharge. So some people might have vaginal itching that is associated with either whitish discharge, or a discharge that is a bit whitish. So those are the most of the symptoms that are mostly seen in from mild to moderate infections of the UTI. We also have whereby you have some severe signs, and you can have so much intense in redness, there is an intense in swelling, and there is a intense in itching that may lead to cracking of the vaginal lips, that may lead to sores, or in other ones that may lead to wounds. So you can also have this yeast infection. If you have this yeast infection more than 4 times in a year, then we can term it as a complicated yeast infection. So when you also have you are also pregnant, or when you are diabetic, or in other ones you suffer from diabetes, then you can be a candidate of uncomplicated yeast infection. The other group of people who has this complicated yeast infection are the people who are immunocompromised. And what I mean by immunocompromised, these are the people who have other comorbidities, or people who suffers from any other kind of infection, like maybe HIV and maybe cancers, and they are on a prolonged use of medications. One thing that I would like to explain this in details is about the causes of the yeast infections, because majority thinks that yeast infection is associated with hygiene, but that is not the case. Even if to some percentage it's linked with hygiene, but hygiene is not one of the main cause of the yeast infection. This yeast infection, they are caused mainly by a fungus that we refer to as the Candida albicans. And let me remind you that the vagina naturally contains some balanced mix of yeast, and that includes the Candida, and it also includes the bacteria. So there is some bacteria that we refer to as the lactobacillus. The lactobacillus acts to prevent an overgrowth of yeast. So this is just like there is a mixture of the Candida, the fungus, and there is a mixture of the bacteria that we refer to as the lactobacillus. So the work of this lactobacillus, it acts to prevent an overgrowth of yeast infection. But if this balancing is disrupted, and maybe the lactobacillus bacteria goes down, then there will be an overgrowth, or there will be an entryway of the fungus that results to yeast infection. So I will talk and say that this imbalance, the things that can disrupt the imbalance between the yeast and the lactobacillus, they can be caused by a prolonged use of antibiotic. So these are the people who keeps on taking antibiotics every time, every now and then. And that is why when you are suffering from a yeast infection, and maybe a doctor mistakenly prescribes the antibiotics, you realize that this condition will not heal, but it will keep on becoming severe. So that one is one thing that can contribute to you having this yeast infection. We also have issues with the pregnancy. We have uncontrolled immunity. We have issues with the impaired immune system. Maybe you might be having maybe HIV, cancer, diabetes, hypertension, any condition that is causing an impairment in your immunity system. And this can also be caused by prolonged use of oral contraceptives, or mostly the hormone therapy that contains high levels of estrogen. So if you are taking oral contraceptives like the Femiplan, or the normal daily pills, and maybe you are being treated for any condition, and you are using most of the pills that contains high levels of estrogen, then you are most probably into becoming a candidate of suffering this yeast infection. So those are the main of the causes, and I can also term them as the risk factors that can contribute one into getting this yeast infection. And any condition that is there, in most cases there might be a prevention method, or what can you do maybe in most cases to make sure that you are not suffering from this yeast infection. Some of the preventive measures that are there, maybe it's when you are taking shower, you are taking a hot shower, you avoid douching, or what we other refer to as normal so much itching. You prevent that. You can also prevent using of more scented feminine products, like maybe the scented tampons, the scented pants, or even using soap to wash your private parts. That can also play a very big role in preventing you from contacting this yeast infection. This can also be prevented by avoiding wearing of wet clothes. Maybe your innerwear has not dried up well, and then you end up wearing it. Then it will continue, or it creates a good environment for the overgrowth of fungus. One thing I will also say that prolonged staying of having a full pant also contributes by a certain percentage in overgrowth of these fungus infection. Now, when you go into the hospital, how can we diagnose that you are suffering from this yeast infection? I will say that yeast infection, most of the time, we can diagnose it from the history of the patient or how the patient presents herself. Maybe you are reporting issues of having itching, you are reporting issues of having a whitish discharge that is not smelly. You have also issues with the pain, or you have maybe a burning sensation when you are having sex, or even when you are urinating. That one can also be a sign of you are suffering from a yeast infection. Any other thing that we can do, we can also have a physical exam where we check where we check the openings of your vagina, maybe the what we refer to medically as the labia majora and minora. We just try to check them, or the vulva. We check it whether there is any redness. We check for any swelling. We check whether it's cracked as a result of itching. We can also have a speculum whereby we insert the speculum into your vagina, and then we try to check the cervix whether there will be any possibilities of us seeing any discharge from your cervical area. So if we check through the speculum and we realize that there are some discharge that are whitish, then we can also rule that one as a way of getting ruling out you are suffering from the yeast infection. In most cases, we can also wonder for a urinalysis, or what we refer to as a urine analysis. This is whereby we check for your urine, and when we check for the urine under the microscopy, we can rule out there is a presence of yeast cells, and that one will mean that you are suffering from yeast infection. The treatment of this condition, we does not give any antibiotic when you are treating this yeast infection. The treatment for this one, we just prescribe antifungals. We can prescribe antifungals as a start medication. We can give it for 3 days, or we can also give it for more than 1 week if this condition is complicated. For example, if you have you have a prolonged history of this condition that has occurred more than 3 times in a year, that is keeping on recurring, we term it as a complicated yeast infection, and so we keep you on a treatment plan that will go over 1 week, whereby we give antifungals for a period of 2 weeks, and then we continue with another antifungal where you will be taking it once in a week for a period of like 6 weeks, until we make sure that the fungal infection is cleared out of your body. Let me say that there are other causes that can lead to this yeast infection, and if it happens you get this yeast infection from any other fungus apart from the Candida albicans, it can be a bit challenging to treat. But in most cases of the patient who presents with this condition, they present with it from the Candida albicans. So that is basically the main difference that is in between the yeast infection and the urinary tract infection. So I will also want to warn some of the medics and some of the clinicians, because those are the most of the people who are in a consultation rooms and who prescribes these medications in big number, that anytime you receive a patient having a yeast infection, you should not manage this patient with any of the antibiotics, because remember, I said antibiotics are one cause of the yeast infection. So this means if you prescribe any antibiotic to treat yeast infection, you will be making this infection to be more worse, because the lactobacillus will keep on being disrupted, that will lead to more overgrowth of yeast infection. So these are some of the reasons why many people go into the hospital having a vaginal discharge and itching. Maybe the doctors make some mistake, they prescribe them with antibiotics, and instead of these patient getting better, they experience more discharge than before, and even itching becomes so intense, because what antibiotics tend to do, they tend to disrupt the balancing between the yeast and the normal flora, and these lactobacillus dies, and then leading to an overgrowth of yeast infection. So that it's all about yeast infection, and that those are the differences that we have in between the urinary tract infection and the yeast infection. Bye.